Welcome to the fourth module of our Family Caregiving 101 series. My name is Mark Peterson, founder of the Wyoming Family Caregiving Foundation. Last session, we focused on performing, directly integrating resources to co-create value with the loved one. Many of the performing tasks are similar to those nurses or nurses' assistants would do in a hospital or clinic. In this session, we focus on brokering, getting things done for your loved one through those outside your network of family and friends. Brokering contributes to family caregiving being proposed to be similar to a complex business project. Agentic family caregivers, those taking initiative and pursuing self-direction, will serve their loved ones as resource integrators similar to entrepreneurs developing a venture. In brokering, you will orchestrate by coordinating and negotiating with other actors such as physicians, nurses, therapists, medical paraprofessionals who provide supportive services to licensed medical professionals, staff members at hospitals and clinics, as well as health insurance companies. During my late wife Cindy's cancer battle, she engaged physicians and their teams in 6 different hospitals across 3 states, Colorado, Wyoming, and Ohio. I was allowed to spend the night with Cindy in the Colorado hospitals as it turned out. That time in the hospital totaled 1 month for me. I've observed much while in these hospitals. Once, Cindy visited a hospital as an outpatient for an intravenous infusion of medicines that would take about 90 minutes to do. I accompanied Cindy for this infusion. While there, I asked if someone could take a look at Cindy's leg wounds. I was told by a person wearing scrubs that she would pass on this request. Long story made short, no one looked at Cindy's leg wounds that day, even though we were there for 3 hours. My mother, Margaret Peterson, worked as a nurse in the emergency room of an Atlanta hospital. Her era of nursing, the 40s through the 70s, featured nurses who were more generalists and would roll up their sleeves whenever called upon. Today, nursing is more specialized. Although it seemed everyone that afternoon of Cindy's infusion was wearing blue scrubs, they might not have treated leg wounds in years. Some likely were not nurses, but wore the scrubs of nurses. The infusion took place in a part of the hospital where chronic illnesses were treated. Leg wounds would be treated in another part of the hospital, like the ER in a wound care specialist office. I also learned that I should not expect having incidental medical treatments done during a visit, even though it took about 15 minutes to load Cindy in a vehicle then because of her mobility issues. I'd have to come back again and initiate another request for more medical services. Physicians' primary focus is the patient. In actuality, many physicians are focused on the patient's disease, or in the case of brain cancer, the tumor. There are some challenges for family caregivers to be treated as part of the patient's medical team by physicians. 3 major ones follow. Some caregivers are highly engaged while others are minimally involved or misinformed, which can complicate treatment. Also, patients can vary tremendously. For example, your patient's appointment with the physician might be sandwiched between 2 other patients who are desperately ill and whose medical treatments aren't working well. Many physicians find it hard to balance patient privacy, HIPAA, with involving family members, leading to unclear roles. Have your loved one designate you as being part of their care team who will accompany them on visits. Taking notes during the meeting is a valuable contribution because many times the instructions from the physician can be extensive and your loved one might forget important elements of what was discussed with the physician. While many physicians are empathetic, they may lack time or resources to address caregiver stress or direct them to support services. Physicians themselves often feel pressed for time and may not engage deeply with caregivers unless there's a clear need. Speak to the physician's nurse or staff person. In interacting with Cindy's medical team in Cleveland, I spoke with the head nurse for the brain tumor group. Instead of just picking up the phone, I would propose times for speaking by phone through text or through email. Many times these calls were taken by Mike on his commute home. It worked that way. During my late wife's cancer battle, she participated in a clinical trial pioneered by Duke University School of Medicine's Tisch Brain Tumor Center. Cindy was directed to university hospitals in Cleveland, Ohio, near Case Western Reserve University for the clinical trial. Such clinical trials help the medical community learn more about innovative treatments. Sometimes these treatments prove valuable for the patient battling a serious diagnosis. About every 60 days, the local hospital and its oncologist would have an MRI done on Cindy. Rather than let 2 bureaucracies, the local hospital and then the Cleveland hospital, handle the shipment of the images, I would request that the MRI images be copied onto a DVD disc. I would then pick up these the same day at the local hospital's imaging office and then go directly to the UPS store in town to ship these overnight to the hospital in Cleveland. I would do this on Monday, and by midday Thursday, the Brain Tumor Center of University Hospitals in Cleveland would acknowledge receipt of these. It cost me about $65 for each of these shipments. Without such intervention by me, I think the shipment would have taken 2 weeks and perhaps be out of date by then and less useful to the physicians in Cleveland. This is a reminder that while talented persons work at your hospital, these persons work in an organization in which some things, such as communicating with other hospitals, could be improved by your involvement. Home Instead provides home care for seniors and those living with serious illnesses. Back in 2021, the fee was $28 per hour for a home health aide to assist in the home tasks for Cindy. Washing, feeding, companionship, such as reading to Cindy, were tasks done by the home health aide, a middle-aged woman from the UK with a college degree who wanted to serve the sick and disabled. It turned out the home health aide was superb as a worker. Here's the note I included for my online 5-star rating of this home health aide a few months after Cindy died. Home Instead came through for my family in an excellent way. Their caregivers showed up on time and ready to do the work we needed to assist my wife in her final weeks. Such help made a big and positive difference in the last days we had with my wife. Our Home Instead caregiver was dynamite. Thank you for helping my family in such a valuable way at this time. The response by Bob McGuire, the owner of the Cheyenne-based Home Instead franchise, follows. Thank you for sharing, Mark. The team is thrilled to receive such a great rating. We're happy to see that you had a 5-star experience with us in caring for your family. Your kind words mean a lot to us, and we value your business and support. We'll continue working hard to make every interaction with Home Instead Care Services exceptional and memorable. Jan became a family caregiver when her father's health rapidly declined due to congestive heart failure, leading to multiple assisted living moves. Simultaneously, her mother was diagnosed with Alzheimer's, requiring constant supervision and support. Jan took a leave from work, coordinated care, managed finances, and advocated daily to ensure her parents' needs were met. She faced emotional and physical exhaustion, struggled with inconsistent facility care, and made major life sacrifices. Despite the challenges, she remained deeply committed, motivated by love and a desire to honor her parents. Her experience highlighted the complexity, burden, and deep emotional ties of family caregiving. Jan repeatedly emphasized the need to advocate consistently for her parents. She intervened when caregivers delayed in attending to her father's incontinence needs. She made repeated calls to staff to ensure care standards were met. She emphasized that caregivers must not assume facilities are meeting expectations without oversight. Quote, I had to be much more proactive. Every day was doing some sort of advocating for him, unquote. The insight here is that family caregivers must monitor care quality closely and be willing to speak up when care is inadequate. Jan and her family moved her parents multiple times due to dissatisfaction. Facilities often claim they met state-mandated staffing ratios, but actual care was poor. The most expensive facility provided the best care with high staff ratios, consistent communication, and culturally competent caregivers. The insight here is that not all assisted living facilities deliver the same quality. Careful vetting, monitoring, and sometimes paying more can significantly improve a loved one's experience. Jan had to scale back significantly on her personal and professional life. She stopped regular exercise, limited social activities, and reduced leisure travel. She coordinated her work and personal life around caregiving responsibilities. Quote, you can't make time, but you can reprioritize your time. The insight here is effective caregiving often requires caregivers to adjust their daily lives and expectations for the long term. Jan described the grief of losing the mother she once knew, despite her being alive. She navigated the sadness of her mother's cognitive decline and confusion. Even routine visits became emotionally and physically draining for Jan. Quote, there's a grief that comes with losing the person your parent used to be before they're physically gone, unquote. The insight here is dementia care brings unique emotional burdens that require preparation, support, and patience. Though Jan took on the primary role due to proximity, her siblings contributed in other meaningful ways. Her brother helped with legal and financial matters. Her sister assisted with logistics remotely, such as online orders. The insight here is open and respectful communication among siblings can create a sustainable, equitable caregiving plan based on location and capability. The best care Jan's mother received was in the most expensive facility. It was about $8,000 a month. Where staff had better training and more empathy, care was consistent and thorough. The insight here is that while expensive, higher-cost facilities may offer better quality, more personalized care, though vetting is still crucial. Financial planning is critical also. Jan's parents didn't have long-term care insurance, but her father had managed investments well. All the expenses were covered by his estate. Medicare, TRICARE helped with medical costs, but housing and non-medical care were fully out of pocket. The insight here is that long-term financial planning is crucial for aging-related care, insurance, savings, or both. Jan shared touching moments that revealed her parents' enduring love. Despite illness, they maintained nightly rituals and affection. This emotional connection helped motivate her to provide high-quality caregiving. The insight here is that caregiving isn't just about physical needs, it's also about preserving emotional dignity and honoring deep family bonds. Family caregivers of individuals facing chronic illnesses such as cancer or neurodegenerative diseases must navigate a complex health insurance system. First, it's essential to understand the full insurance policy, including coverage details, exclusions, and requirements for pre-authorization. Caregivers should obtain legal permission via a HIPAA authorization, HIPAA meaning Health Insurance Portability and Accountability Act of 1996, to communicate directly with the insurer on the patient's behalf. Keeping detailed records of all communications, claims, and paperwork is crucial for resolving disputes or filing appeals. Many insurers require prior approval for certain treatments, medications, or equipment, so proactive verification can prevent denied claims. Understanding financial responsibilities like deductibles, co-pays, and out-of-pocket limits is also key. If your loved one does not have health insurance, see the social worker at the hospital for help in interacting with the hospital's administration staff for the purpose of developing a payment plan for you and your loved one. Don't pay cash immediately. Initial prices for medical treatments are really for the hospital or clinic to bargain with insurance companies. There needs to be a reduction in fees for someone who would pay themselves and not through an insurance company. Caregivers should ask about case managers, disease-specific programs, or support services that may help coordinate care and reduce costs. If a claim is denied, knowing how and when to appeal and escalating to supervisors or state regulators if necessary can make a significant difference. Hospitals, nonprofits, and legal aid services can offer valuable assistance here. Ultimately, for family caregivers, staying informed, being organized, and being persistent will empower you to advocate effectively for your loved one's care while minimizing financial and administrative burdens. My own experience with a health insurance company occurred during Cindy's cancer battle, which lasted 2 years. A few weeks after being diagnosed with glioblastoma, estimates of billing from UC Health and medical providers began arriving in the mail. These were informing me what would be requested from my health insurance company, Cigna. Eventually, Cigna let me know what I had to pay, my deductible, a few $1,000s in all, until the balance above my deductible payment would be paid by Cigna at 100%. During the first month of Cindy's cancer battle, I received a letter from Cigna informing me of the name and phone number of the oncology nurse case manager for Cindy. I repeatedly tried calling the phone number, but I was always directed to voicemail after about a minute of punching in numbers at the request of Cigna's corporate phone management system. The message I left in the voicemail was, "This is Mark Peterson. Here's my wife's case number. Please call me at this phone number." I don't remember receiving a call. Not surprisingly, I found this frustrating. One time I called and left a different message that ended differently. Instead of just asking the oncology nurse case manager to call me, I left detailed instructions on what I needed to answer questions the local hospital's administration staff needed. The next day, that information was delivered to me. It worked. In future dealings with the oncology nurse case manager, I used the same approach of broadcasting in the blind, so imagining an oncology nurse case manager would hear my message and take care of my request. We continued to work this way over the course of Cindy's cancer battle. It turns out that the oncology nurse case manager had little time to return phone calls, but had enough time to take care of well-informed requests that I would leave on voicemail. I was in another culture in the world of corporate healthcare insurance companies. I had to learn how to interact with those who worked in this realm. Medicare is a federal health insurance program primarily for people aged 65 and older, as well as younger individuals with certain disabilities or end-stage renal disease. It is divided into 4 parts. Part A, which is hospital insurance. Part B, which is medical insurance. Part C, Medicare Advantage offered by private insurers. And Part D, prescription drug coverage. Caregivers should be aware that Medicare typically does not cover long-term custodial care, such as help with daily activities. It does, however, cover limited home health services if medically necessary and prescribed by a doctor. Out-of-pocket costs like premiums, deductibles, and co-payments can still apply, and late enrollment penalties may occur. For caregivers, it's essential to understand coverage limitations, to track enrollment periods, and consider supplemental plans, such as Medigap, to help with costs. While Medicare helps with many medical needs, it may not fully support the extended care often required for chronic or degenerative conditions. Medicaid is a joint federal and state program that provides health coverage for individuals with low income and limited assets, including many elderly and disabled individuals. Unlike Medicare, Medicaid covers a broad range of services, particularly long-term care, including nursing home stays, in-home personal care, and community-based services. Eligibility requirements and covered services vary by state, and the application process can be complex. Some states offer waiver programs that allow individuals to receive long-term care at home rather than institutions. Caregivers should understand spend-down rules where individuals may need to reduce their assets to qualify. Medicaid is often the only financial support for families needing extended care for loved ones with chronic illnesses or neurodegenerative diseases. Dual eligibility, qualifying for both Medicare and Medicaid, can reduce out-of-pocket costs and expand benefits. Caregivers are encouraged to seek assistance from social workers, elder law attorneys, or Medicaid offices when applying. SHIPHelp.org is the official website of the State Health Insurance Assistant Program, SHIP, a federally funded service offering free, unbiased Medicare counseling to older adults, caregivers, and families. It's available in all 50 states and U.S. territories. SHIP helps caregivers understand Medicare options, compare plans, resolve billing issues, and identify cost-saving programs like Extra Help and Medicare savings programs. The site features a SHIP locator to connect users with local counselors who provide one-on-one support by phone, in person, or virtually. SHIP counselors are trained to answer complex questions, assist with plan selection, and help report potential Medicare fraud. SHIPHelp.org also provides tools and resources for SHIP program staff, but for caregivers. It's a key entry point to personalized guidance. It's an essential resource for navigating Medicare confidently and ensuring that loved ones receive the coverage and benefits they're entitled to without unnecessary costs or confusion. 3 groups offer caregiver-oriented guides: the Family Caregiver Alliance, the AARP, and the Medicare Rights Center. During Cindy's journey, the nurses who provided care for Cindy proved to be very effective and to be real pros. 2 thumbs up. And at home, she always had her faithful friend Bingley right by her side. Please join us for the next video in our series about aspects of important relationships for family caregivers. This video and other resources to help you become a more effective family caregiver can be found at wildfamilycaregiving.com. That's www.wildfamilycaregiving.com. Thank you.